Welcome to the Jaros Health Podcast, where we make it easy for you to better serve older adults through our content that informs, community that inspires, and courses that deliver.
Hey, Alyssa here. Welcome to the Jaros Health Podcast, where we make it easier for you to better serve older adults. My name's Alyssa, and this is the Old Not Weak segment. So today, I wanted to actually discuss an article I found in the Journal of Geriatric Physical Therapy from the April to June 2019 edition. And it's discussing the effect of physical activity on the quality of life in osteoporotic females living in residential facilities, a randomized controlled trial. So I thought this was kind of interesting because a lot of times we get caught up in the outcome measures, the very objective things. And sometimes we have to kind of think about, especially in residential facilities, people that you might be seeing long term, we have to kind of look at other psychological things as well and quality of life. So this was honing in on particularly women with osteopenia or osteoporosis. So we know that osteoporosis can limit movement, causes an increased fall risk due to the fractures that can develop and that they can be more severe than normal adults. So it's been shown that osteoporosis has an adverse effect on the frame of mind of the patient. So you can have mood downswings, insomnia, just overall general fatigue and malaise, which we see a lot in most of our, I'm speaking on the home health side, patients. Those are very commonly reported symptoms. So osteoporosis is also attributable to fractures, poor general function, strong pain, postural deformities, advancement of the disease as your bones get weaker, as you're not moving around as much, and lower physical activity. They also found that the quality of life was rated significantly lower by the physically inactive persons rather than the active ones. So what they wanted to kind of look at was assess the level of activity and the risk of falling in osteoporotic and osteopenic female residents, but then also assess how an exercise program and a combination of an exercise program can affect these women. What they did is they had 4 groups. They started with 91 people and they ended up having 83 participate. What they did is they split these 83 females into 4 groups. Now, one of the main inclusion criteria was you have to be independent with mobility. You have to not need physical assistance. I believe you could be in this study if you use an assistive device, although they didn't explicitly say. So the first group had just the control. So they were just using pharmacologic treatment, no exercise or anything. The second group used an exercise type called the modified Sinaki. So the Sinaki exercises, as described in the study, are performed in a prone or supine position, hands and knees, sitting in a chair, or on the floor with legs extended forward. So it sounds like there's multiple positions these exercises can be completed in. And basically the objective of the exercises is to correct the silhouette. So usually with osteoporotic patients, it's going to be more of a kyphotic posture, improve lung ventilation, and prevent joint contractures while strengthening all those corresponding muscles. So the second group got that type of exercise 2 times a week. The third group used a Nordic walking program, which is basically a walking program with using Nordic poles. And I've used it myself with patients with Parkinson's disease, but it's kind of gaining a lot of track with a variety of diagnoses. Mainly you're just walking, whether it's on uneven surfaces, kind of on, trails that they set out. So, you could just make it around the building. You could just make it a very short, straightforward path. They were doing that twice a week. And then the fourth group had a combination of the Senaki and the Nordic walking. So in all the exercises groups, so exercise group 2, which is using just the Senaki, exercise group 3 that was using just the Nordic walking, and exercise 4 that was using a combination of both, each of those people got 2 times a week for about 45 minutes or so. This study extended for 12 months. So they are looking at the 2 times a week for a span of 12 months. So the measurements they used were, they did a tug on everyone. They did a functional reach, both of those to assess fall risk. They did a quality of life questionnaire, which they mainly honed in on in the results. And they also used pedometers to track physical activity or steps 7 days before the start of this and then 7 days afterwards. So in the results, basically there was really no significant difference between the tug or the functional reach. Both of those, they found insignificant results across the board. When they started looking at the quality of life questionnaire, now this questionnaire had multiple components. So they used the QUALEFFO41, if anyone's familiar with that. So basically they're looking at pain, activities of daily living, jobs around the house, mobility, leisure and social activities, general health perception, and mental function. So this questionnaire is basically a subjective rating of those. So you can score from 0 to 100. The higher scores are representing a lower quality of life. So basically they ask questions about those specific things and then they kind of rate their ability to do that. So, and then they take the average and make the score. So they kind of divided it when they were looking it up into those subcategories and kind of delved in a little bit deeper into those. So the quality of life, overall general score increased in groups 2, 3, and 4. So all the exercise groups increased the quality of life. It actually decreased in the pharmacologic group. So scores for the activities of daily living improved in all intervention groups, but in the control group, they were actually worse. Jobs around the house, they, again, were better in the intervention groups, worse in the control. And then the mobility section addressed both standing up and sitting from a chair and doing stairs. So again, it's not a physical test, but it is a subjective report. So groups 2 and 4 scored better on the mobility component. So the Senaki and then the combination. But in groups 3 and 1, they were worse at baseline. So in the Nordic walking group, those scores rating mobility were actually worse. As far as pain is concerned, it was better in groups 2 and 4, so the Senaki and the combo again. It wasn't significant, but it was better, and it was again worse in the control and also in the Nordic walking. So basically, with those results, they kind of came to a conclusion. There's other details if you want to take a peek at the actual report. Basically, they came to a conclusion that most of the intervention improved at least a small part of quality of life. So basically, intervention is better than nothing, which most studies, come to that conclusion. But they found that the combination of both the Nordic walking with these Sanaki exercises had the best outcomes. So you want to not only, stick to a walking program, but also supplement with a few other exercises that may help the perception that they're able to complete stairs and complete transfers safely. So just walking doesn't technically transfer over to that perception. So then you look at, is 2 times a week, that's very feasible. I know in the home health setting, that's typically how often we see patients is about 2 times a week for that 45-minute time frame. But this study also went on for 12 months. So then you question, how long would this actually be feasible for in a physical therapy setting? But this could be translated over to like an exercise class that kind of runs all year round, about once or twice a week, depending on the time frame, 30 minutes to an hour. So that could be translated to more of a group exercise setting than just a specific one-on-one. So that also helps give us another reason to kind of coordinate with, if we're seeing someone in an assisted living or an independent living facility, coordinating care afterwards so they can carry on and then hit that 12-month mark. So after the discharge from physical therapy, if they're able to continue on with exercise classes so they can get a little bit closer to that longevity that they may need in order to make significant improvements. So then they also mentioned, why do people have this low quality of life? Basically, it's the lack of leisure, social activities, because they feel like they can't move around and they're going to fall, and so they don't participate in many things. Poor self-assessment of help, so basically decreased confidence in their mobility, and then that feeding into just overall reduced mobility. So all of those improved with these interventions. Those were other components of that quality of life questionnaire. So, to make a couple of inferences after I was reading this and thinking about it, one easy way that you could help improve, especially in assisted living facilities and residential care facilities, is you could just add in a Nordic walking program, because it's very inexpensive for the most part, just depending on the pole cost. And so it might be more appealing than like a regular walking program. If people can use these poles, they almost look like ski poles a little bit. If they can use these poles, and it helps keep more of an upright posture. It helps kind of emphasize upper extremity arm movement. So with more of your advanced patients and advanced residents, this might be an easy option to kind of help improve aside from just regular walking, and it might help increase adherence a little bit. But then again, we look at the need to supplement walking classes with other exercise to help increase the benefit. So even if, looking more at an implementation for a group exercise class would be do maybe a few exercises before you go out to the Nordic walking, just a couple, so it's still kind of targeted more towards a walking program, but to warm up and things like that. That could be another easy way just to kind of help increase outcomes. And then on more of the treatment side and more of the evaluation side, when we're treating residents in an assisted or independent living, long-term care, things like that, maybe it would be worth it to look at quality of life, an objective measure as well, because we know that quality of life can be improved with exercise on a global scale. So whether you use certain components of even the one they used, or there are others, most of them are going to be surveys on more of a question rating basis. But it'd be one other outcome you could look at, because a lot of times if you are treating some of these long-term care patients, we may not make leaps and bounds of improvement. We're just, improving their general mobility and things like that, and making, decreasing fall risk. But this could also be another measure to use. Say if you start to hit a plateau with a patient as far as improvements, we can kind of look back at this and say, okay, their perception of their mobility is getting better, their perception of the activities of daily living, because in the study, the tug and the functional reach, they weren't significantly different between the groups. So this is looking at more of a psychological approach to treatment, and it does make a big impact on the treatments as well, because if patients are fearful of falling, they have a poor confidence in their mobility and things of that nature, then that could be impeding their physical outcomes. So I think it would be something to look at, especially in those patients in those residential care facilities. If you could find just a quick and dirty couple of question survey to kind of give them if you deem it appropriate. Because even if they're not making physical gains, they could be making psychological gains, which could improve their quality of life, which is huge in these facilities, because sometimes we have those patients who fall into that depression and fall into that impaired mobility, and it's just kind of this vicious cycle they start to go through. But so if we can stop that either with use of treatments of physical therapy or on a group exercise basis, we can impact quality of life according to this study. The link for the study will be in the show notes, and if anybody has any questions, feel free to let me know. Thanks for tuning in, guys. Have a good one.
Thank you for listening to the Jaros Health Podcast. Go to jaroshealth.com to get the show notes for this episode and find out how you can join the Jaros community for free. You'll get access to our private Facebook group and the weekly Jaros Recap, where we share our favorite reads, podcasts, and any interesting conversations in the Jaros community that week. Once again, that's GEROS health.com. Thanks for listening.